Hey, I'm Stephen Bradley, anesthesiologist, naval officer. Thank you so much for joining me again on this channel. I really want to bring great information for folks that are interested in military medicine or the field of anesthesiology in general. If you haven't done so already, if you like what you see thus far, go ahead and click the subscribe button. It's going to be down there to the left, or my left, your right, I suppose. Hit the subscribe button, give me a thumbs up, thumbs down, let me know what you want to know about military medicine, anesthesiology, or anything related to those topics. So today I'm going to be talking about the HPSP, or the Health Professions Scholarship Program. This is one of the things I get asked about the most when it comes to military medicine, because this is a way that most military physicians actually end up joining the service. So you're probably somewhat familiar with the program, but the Health Professions Scholarship Program is essentially a 4-year scholarship that pays the cost of tuition to medical school. So medical school is expensive. Why wouldn't people take this offer? You know, what's the big deal? What are the risks, benefits, pros, cons, all of that? That's what I'm here to talk about today. So it's a great program for the right population of people, folks that are interested in military service, folks going to medical school, etc. But one of the problems with the program is it's hard to get information downstream of signing up for this contract or for the scholarship program. So a couple things that I want to get out of the way early. Number one, you should approach this as a future job contract. So when you're looking at joining the military or accepting this HPSP, or Health Professions Scholarship Program, you're probably going into your first year of medical school or in the middle of your first year of medical school. You have to realize that this is an employment contract that will begin for most people after finishing medical school, and then for other people it will start once you're done with residency. But this contract could run you at least 4 to even 8 years or longer once you're done with your training as a medical student, become a physician. So that's the first thing that you definitely need to realize. Next, when you're thinking about joining and taking advantage of the Health Professions Scholarship Program, definitely find a military physician to speak with, somebody that's been through the program or somebody that's practicing currently on active duty. They're going to have a wealth of information that they can tell you about the program and about what their job is like as an active duty military physician, like myself, I guess. And one of the things to note when you're joining the military, you don't really know, or you may not have any familiarization with the rank structure or who you're actually talking to. So the military, as I mentioned in a previous video, it's divided between officers and enlisted members. So enlisted folks are the folks that come out of high school and enlist or join for whatever reason. Most often, you know, you haven't been to college, and there's a range of the enlisted ranks, and then once you've been to college or the Naval Academy or gone from enlisted officer, then you can become an officer. Officers are more like the leaders in the Navy, and then, or in the military, then there's enlisted and then senior enlisted, so on and so forth. What you have to watch out for is that to be a recruiter, that is a job for enlisted ranks as well as for officer ranks. So at a lot of places, you'll have enlisted folks that are recruiting medical students, nursing students, all these folks for these officer roles. And that usually works out okay for the regular Navy or regular military side of things, where folks are, you know, they're pretty familiar with that role because they're working together on a ship or at a Marine base. You work very closely with the enlisted soldiers and sailors that you're with. When it comes to the medical field, though, the enlisted service members really don't know much about what goes on in the medical community, because you're both an officer and a physician or nurse or whatever the case may be. And there's just not a lot of visibility about what goes into practice as a military doctor, especially coming from one of the enlisted service members. And that goes all the way to the top, whether they're a petty officer, first class, or even a chief. They just don't know, they haven't had that exposure, that experience to what goes into a career as a military physician. and they don't know what doctors are looking at. And I did talk to one of the guys when I was joining, and he kept raving and raving and raving about the bonuses that I was going to get, but he had no idea that even with those bonuses, my salary is less than 50% of what a lot of folks make on the outside. So there's just a lot of context that's lacking. So make sure you find somebody that is in your field to talk to. There are even officer recruiters, they're officers, but they're not in the medical corps. Sometimes they have nurse officers interviewing to bring in physicians to the scholarship program, etc. So long story short, find somebody that is a physician if your goal is to come in as a military physician or nurse or whatever the case may be. Just find somebody from your field to discuss how their experience has been in the military. That's the first thing that I would talk about. So specifically speaking about the Health Professions Scholarship Program. So this program itself usually runs for 4 years, and this program provides a stipend, a housing stipend. It's about $2,400 a month, and the numbers change every year, but it varies. It's about the same, $2,400, $2,500 a month, monthly housing stipend. And then there is a tuition payment that the military does. The military is covering the cost of your tuition the entire time you're in the program. Usually folks get the HPSP for 4 years, so it covers all of medical school. Sometimes they'll get it for 3 years, and it covers 3 years of medical school. It's important to note that really only covers tuition. It covers books as well, but you do have to fill out paperwork and send that in to get the stuff reimbursed. So it's only tuition. At Howard, let me think. I think the medical school, I want to say my tuition was 35 grand a year. But with the cost of living in DC, I was able to take out, I think, 60 grand or so in student loans every year. I needed that money to live on in DC. So the Health Professions Scholarship would pay that tuition, that $34,000 a year. And then you'd kind of be on your own for the rest of that money, your living expenses outside of that $2,500 a month stipend, whatever it is. So hopefully that makes sense. So how do you join? You'll go. It's not incredibly difficult. You find a recruiter. They can get you in touch, give you the right paperwork. It can be a lengthy process because you're dealing with the government. Things take longer than you would probably think they should. Things take longer. They take a long time. So get the process started. You can start as soon as you get your acceptance to medical school usually, and you'll have a couple months to kind of work through that. And they usually accept people going on through that first and maybe even into the second year of medical school. So you'll get a physical exam, you'll get sworn in or whatever, and you'll get your tuition paid for. You'll start getting that housing stipend. During the time you're in medical school, ideally they'll send you to Officer Development School. It's a 5-week program up in Rhode Island where you learn military customs courtesies. You get to buy your uniforms, all that. I say get to buy your uniforms, you buy your uniforms. And that usually works out, I think, between first and second year of medical school, when you may be studying for STEP, or maybe you've already taken your STEP exam. No, between first and second year of medical school, when you have that summer off. That's what it is. That one free summer you have, ideally I want you to go to Officer Development School. You hang out there. You do get paid active duty pay when you go to a program like that, which would be based on you being an O1 or an ensign in the Navy. I think it's second lieutenant in the Army and Air Force. Don't quote me on that. So for that 5 weeks that you go to the Officer Development School, you would make a little bit extra money. I think they probably make about $45,000 or $50,000 a year as O1s, and that's roughly what your pay would be extrapolated out for the 5 weeks that you're in the program. Otherwise, there are opportunities to kind of go on active duty a couple times a year. You do like a 2-week stint, and they'll pay you, whatever you make in the military. And during that time, you do have military benefits. This really comes into play during your 4th year when you're doing your 4th year when you're doing your away rotations and preparing to match, because they'll want you to do rotations at different military treatment facilities or Navy or Army military hospitals to kind of see what that life is like, get you around some folks in the field and in the service already, and that prepares you to fill out applications to match into the military. When it comes time to match, it does get a little tricky. You're going to need to apply to military programs. They want you to do military match, and if they have spots available, or how do I put it? So you're going to apply to military residency programs. They have a bunch of different programs and specialties: general surgery, anesthesia, otolaryngology, a lot of stuff to offer. Sometimes they don't have enough spots for the interest or for the needs of the Navy. If that happens and they can defer you, you can go out and they give you opportunity to apply into the civilian match. So this can be a little stressful for students because you're basically applying twice. You're applying to the military match while you're getting your civilian match application package put together. You're applying to military match, seeing if they will allow you to go out and enter the civilian match. So for some people, they're actually out interviewing for civilian positions without knowing if they can even match into these positions. So then, two things can happen. Either you will match into a military internship, or they'll defer you, and then you can match out into the civilian world. The commitment, or what you owe for this HPSP program, is 4 years. But it's not just 4 years, as it's a little catch to it. So you go into medical school, you get the HPSP program, you owe 4 years. You're going to finish medical school and you're going to match. Say you match into the military program doing general surgery. It's a 5-year residency program. That first year doesn't count towards payback. It's kind of a freebie. You just do it, you get through it. So you still owe 4 years. After that, there is 2 options with the Navy, at least. You can either proceed with your training to be a general surgeon, or they may send you out into the fleet. It's not really your choice to make. There's a lot of other factors. The Navy uses general practice physicians. So you've done a year of internship and you can go into either general medical officer, dive medicine, flight medicine. They're basically like primary care type roles, and you would do that for however long your orders are. Usually they're 2 years or 3-year orders. So if you owe 4 years, you've done your 1-year military internship, you still owe 4 years. If you go out to general medical officer land on 3-year orders, you would pay back 3 of those years you'd owe. You would have 1 year left that you owe. At that point, you can either extend and stay that extra year and get out of the military and then do a civilian residency, or you can apply to military residency programs even though you only owe that year, and then you come back and the residency doesn't, you kind of accrue a year and lose a year at the same time. So I think if you had 1 year left, you'd get out, and you usually owe at least 2 years. So if you did your residency program, you would come out and owe 2 years on active duty before you could get out or do whatever else you wanted to do. Alternatively, if you matched military general surgery, you do your 1-year internship, which doesn't count, you still owe 4 years. You do your 5 years of general surgery residency. I believe you get out and you finish residency, you still owe just the 4 years. I don't think you add on an extra year. I think you just owe the 4 years, and then you could work and do whatever. So that is kind of the timeline that you have for military medicine and matching into different specialties, and how much time you owe and how much time you accrue. Now, when it comes to finances, I'll probably just have to put that into a separate video, because a lot to unpack about the finances between having your medical school paid for, how much you're making in residency as a military resident versus civilian, and then how much you're losing as a military physician on active duty when you're done with your training. That's a whole other can of worms that we'll get into probably in a different video. But the takeaway points from this health professions scholarship program video overview is just, make sure you know what you're getting into, review the details and how much time you owe. Definitely think about what you want to go into. So if you want to be a neurosurgeon, the military only has 1 neurosurgeon a year that trains through the service. So you would have to be the best of the best to match into the military neurosurgery program. and then you would have to you would be applying to both military neurosurgery, and then if they say, okay, we need an extra neurosurgeon, they can give you the honor and privilege of applying to the civilian neurosurgery program. So that's kind of how that would look. When it comes down to, say you want to do hematology oncology, you would match to the military match, but then you would have to ask permission essentially to do your fellowship in hematology oncology. Usually they want you to work a couple of years before they send you back to fellowship. When you go back to fellowship from the military on active duty, they do pay you active duty pay for your fellowship, but it's a year for a year payback plus one. So a 3-year hemonc fellowship, you'd end up owing 4 years in return. And again, it's if the military says we need another hematologist, oncologist, they will allow you to do a fellowship like that. So it can really affect, what you want to do, what area you want to practice in. If you want to, be a peds ENT surgeon, again, you just have to ask permission to be able to do these fellowships. So these are things that, I think people should know going into this program and accepting the scholarship. And just make sure you talk with somebody in the field before you commit yourself to this path, because you are essentially signing a job contract as a first-year medical student, and the job doesn't start for 4 to 5 years, and the job's going to last up to about 8 years depending on how you join. So let me know what you think of this video. This is going to be a couple more videos in this series, I guess. I'm going to talk about the financial assistance program, which is the program that I use to join the Navy. It's a different program, still provides some financial aid, if you will. And I'll answer whatever other questions you have about the HPSP program. Thanks so much for joining me on Ask an Anesthesiologist. Stephen Bradley. Tune in next time. Don't forget to like, share, subscribe, follow, all that good stuff. I'm also over on Instagram. StephenBradleyMD.com is my website.